Hi viewers, I'm Dr. Ruchira, your dental surgeon at Eledent Hospitals. We are located in Kondapur and in KPHP. Today I'm going to speak about tooth extraction or removal of a tooth. There are different scenarios in when you have to go for an extraction. Namely, 1. Wisdom tooth extraction. Number 2. Impacted tooth extraction. Number 3. Grossly decayed extraction. And number 4. Fractured teeth extraction. These are the 4 different scenarios under which we go for extraction. There is also another type which is usually orthodontic extraction. Okay, so I will be explaining it to you in that every patient is supposed to have a lot of pain in their wisdom tooth, but sometimes what happens is you tend to have a lot of pain or say food getting stuck or different types of decay in your wisdom tooth. So patients where you do not get to know whether there is any pain or any discomfort, you should always make sure you visit your dentist the minute you realize that you have your wisdom tooth present. But sometimes what happens, that wisdom tooth being there itself is going to make a trouble to the tooth present next to it. What happens is it starts pushing away the tooth next to it or tries to stick on to the tooth present next to it, because of which the tooth which is there tends to also decay. So in scenarios like that, you have to make sure you visit your dentist to just for a general knowledge or for your checkup to know that if the tooth is fine or not. In other situations, food gets stuck for patients, but they think food is getting stuck, we'll gargle a little, we'll spit it out, it should be fine. But no, it's not going to work that way. If there's food getting stuck, that means there is going to be decay. No matter how hard you try to maintain it, you'll tend to get a lot of foul smell from your mouth and things like that. In situations like that, you have to get your wisdom tooth removed. And a lot of people ask, madam, there is no relationship between the tooth and the eye, or what happens, will I become partially blind if I try to get my tooth removed? Let me make it very clear to you. Your tooth is itself a unit. It is not related to your eyes, your nose, your mouth or anything like that. Okay, it doesn't mean that you will have any pain all over your body or no pain in the eye, in the ear after removal. So patients always keep saying, madam, eye ki related, it's going to get related to my eye. No, it's nothing like that. So you can go ahead and normally get your tooth extracted. People even tend to ask, after the removal of the tooth, do we have to place another tooth? No. Wisdom tooth do not need to be replaced. Once taken out, it is good. You don't have to replace it again. This is when we are going to do about wisdom tooth. Wisdom tooth are placed in different directions. Some are present straight, so horizontal, vertical, or they are present too much inside the bone and still causing you pain. So with us, we have something called as a Piezo Surgery. Piezo Surgery is nothing but a surgical instrument which we use to remove these wisdom tooth. It is little bit more on the expensive side compared to your normal extraction, because when we use this device, you have minimal bleeding, no much swelling, and usually only a maxillofacial surgeon can opt to do a surgery like this. Very few clinics over here in Hyderabad have this kind of facility where they use a Piezo Surgery unit to remove your tooth, your wisdom tooth. So each time you go to a dentist, please ask them for a Piezo Surgery removal of your wisdom tooth, which will cause you lesser pain. So this is when it is about wisdom tooth. The second one is when your tooth is decayed. So usually if it is mildly decayed, in my previous videos, like I have told you, when a root canal happens or what is a root canal, over here when you cannot do a root canal, your tooth cannot go ahead with any root canal kind of a treatment, that is when your infection has reached your root and your gum is overall infected. If it is completely moving because of gum problems or different issues, that is when you have to get your tooth removed. This is your normal extraction. For this, you will not really need a Piezo Surgery. Piezo surgeries are used only to remove your wisdom tooth. The third type that I am talking to you now is about any tooth which gets fractured. So people tend to meet with different accidents, or they tend to bite on something too hard. That is when the tooth breaks off into 2 pieces. When something like that happens, you have to get that tooth removed. That is an again a situation where I cannot place it back. In certain situations where the tooth is moving very little, that's when I can place a splint, something called a splint, to make sure that your tooth doesn't move any longer. So basically we try to fix it in a way with a wire to make sure it doesn't move. And mind you, when I'm saying it does not, when we can do this is only when it is very little moving. So we have grades, we have grade 1, grade 2, grade 3. We decide whether we can fix it back or we have to remove it. Okay. Number 4 type is impacted. Some patients tend to have pain here and there, unusual pain or unknown pain present in the mouth here and there. Sometimes the pain is most likely to be in this area or in this area, but it is very vague. You constantly have it, so after a period of time you get used to this pain. That is a situation where it is impacted. When I say impacted, that is there is already a tooth which is present on the inside, which is trying to push the teeth present on the outside. This you will only be able to find out after you take an X-ray, where you will be able to differentiate and know if there is a tooth coming. It will either be anywhere here or anywhere here. Usually it happens with impacted canines. What happens is it starts pushing itself and tries to create more pressure on all your teeth. It is a very vague and a very discomfort type of a situation. Situation like this also, you have to get those teeth removed. Next one coming, orthodontic extraction. The number 5 that I had mentioned is an orthodontic extraction. This is an extraction which 90% of the patients who are undergoing braces treatment. You can see our other videos where we have spoken about orthodontic treatment and about braces. So for patients like that, it is mandatory in 90% of the patients to get them removed. This is how it works when I am talking about different types of tooth extraction. So please visit your dentist to know more about all your teeth and to make sure that your oral health is maintained well. Till then, take care. Bye bye.